Lymphoma and Immunotherapy. What is lymphoma? Lymphoma is a cancer of the lymphatic system. The lymphatic system is a component of the immune system that aids in the body's fight against viruses and bacteria. Lymphocytes, which are white blood cells, can develop improperly and cause tumors throughout the body. The most prevalent kind of lymphoma is non-Hodgkin lymphoma, whereas the other type is Hodgkin lymphoma. Where does lymphoma occur? Lymphoma can develop everywhere there is lymph tissue. Lymph tissue is a component of the immune system which aids in the fight of infectious diseases and illnesses. Lymphoma can develop in the thymus, groin, and lymph nodes all throughout the body. Because there is lymph tissue there, lymphoma occurs there as well. What are the symptoms of lymphoma? Non-Hodgkin lymphoma and Hodgkin lymphoma share symptoms such as discomfort, swelling in the neck, fever, weight loss that comes and goes, persistent exhaustion, and severe itching. What is immunotherapy? Immunotherapy is the process of enhancing or inhibiting the immune system in order to treat disease, or in this case, cancer. To strengthen the immune system's function and destroy hazardous cancer cells, lab-made cells are injected through a needle into a vein to stop the growth and kill lymphatic cells. How does immunotherapy work against lymphoma? CAR cell therapy is a sort of immunotherapy that deploys T cells, a type of white blood cells affected by lymphoma, to fight lymphoma cells by generally altering them in a lab to make them more efficient by detecting and killing lymphoma cells. Because it includes changing genes inside a T cell to help them fight lymphoma, CAR T cell therapy is indeed a cell-based gene therapy. What is the difference between immunotherapy and chemotherapy? Chemotherapy targets the tumor directly with drugs or high-intensity energy beams such as X-rays and protons. And on the other hand, immunotherapy genetically modifies immune system T cells to help the immune system combat cancer cells. Immunotherapy can also assist in strengthening or suppressing the immune system in order to limit the spread of the disease. What is the cost of immunotherapy? The price of immunotherapy treatments varies on where you live. Although in Canada some drugs are occasionally financed by health insurance, the cost varies depending on how severe the cancer is, and it can range anywhere from $10,000 per month to $100,000 per year in moderate cases. In the United States, therapy and medicine cost roughly around $200,000 each year. Are there any side effects from immunotherapy? The following are the possible side effects of immunotherapy: dizziness, severe nausea, headaches, weariness, muscle and joint pain, fever and chills, diarrhea, and problems breathing are all possible side effects of immunotherapy. Immunotherapy can also damage healthy cells in the process of killing cancer cells. What is the success rate of immunotherapy and how do survival chances increase? Despite the fact that these therapies harm some of the body's healthy cells, 82% of lymphoma patients who have received immunotherapy, especially CAR cell therapy, saw a prominent impact within a month of treatment. Life expectancy also goes up by a couple years if you are not fully cured of the cancer. How are T cells genetically modified in labs? T cells are changed once a sample is taken from the patient, and following the collection of the sample, the cells are changed to produce structures on the surface of the cell known as chimeric antigen receptors, or CARs. CARs are cell receptors that aid in the destruction and killing of cancer cells, and they also spot cancer cells a lot easier.